Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, January Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Denise Testa, audiologist with Hear the Possibilities. Good morning, Dr. Testa, and welcome back to the show.
Thank you so much. I appreciate the time.
All right. About 48 million people, or about 15% of the population in the US, have some degree of hearing loss, but many of them struggle acknowledging it. Of those 48 million people with some degree of hearing loss, about 1 in 5 of them will seek treatment. People may be embarrassed or ashamed about losing their hearing. Some see hearing loss as a sign that they're getting older, and they may ignore that and pretend it isn't happening. They also might be worried about the cost of hearing aids, or the way technology looks or functions. According to the Hearing Loss Association of America, the average American takes 7 years to seek help with hearing loss. Hearing loss has been linked to social disengagement, increased risk for dementia, and other physical and emotional consequences. In other words, a loss of hearing can put you at health risk. We'd like to remind our listeners you can join us on our podcast. Just look for Health Matters with the Medicine Center in your favorite podcast app, and please subscribe to our program.
So, Dr. Testa, welcome back to the show, and tell us a little bit about yourself and your background and training.
Well, I have been practicing in the North Canton area for about 25 years. I received my undergraduate degree and my graduate degree from the University of Akron. And then I received my doctorate in clinical audiology in 2006 from Salus University, which is in Philadelphia, Pennsylvania. I'm a born and raised Ohio girl. I haven't really moved too far from where I grew up. I grew up in Portage County. I met my husband in college. We will be celebrating our 29th wedding anniversary this year. I have a almost 22-year-old son who is graduating from the University of Toledo in May. He will be graduating magna cum laude, so very proud of him.
Wow.
And I have a 17-year-old daughter who is a junior at Lake High School, who keeps us busy with her activities, which include marching band, competition cheer, gymnastics. She does it all, but we wouldn't have it any other way.
So does she have her own chauffeur or?
Oh, no, she has her driver's license now.
Okay.
Her chauffeur was her father for a while because my
Okay.
husband works. He has his own business at home. So
Okay.
he was able to work around his schedule with her craziness.
Okay. So we are excited to share that you have opened a new practice. Hear the Possibilities. Tell our listeners about your practice and where you are located.
Well, I'm very excited. This is the last day of my 3rd week. So I just opened on February 1st. My address here in North Canton still, and it is at 6231 Frank Avenue in North Canton. It's right across from Stark State, and we're in the South Professional Building. And so it's a very easy entrance. We're right up front on the right-hand side. So we are welcoming all new patients. The funny thing is, being my own boss, I came home from work the other day and my husband was like, okay, so you had a long day. How was like day 10? And I said, you know what? I said, my boss is awesome. And he just laughed. So it's definitely a change. I know how to do audiology. It's all of the back stuff, learning our new computer systems and all of that. But it's a welcome change at this point in my life. So
Very interesting. Okay. Being your own boss is really a challenge. How many dozen employees do you have? I know.
I only have one. I had to start small.
I see. Okay. So as an audiologist, what kind of issues do you treat? Do you treat people of all ages, children and sorts?
Yes. We treat newborns all the way up to geriatrics. I believe my oldest patient is 102 and she still comes in. She got new hearing aids last year. And so we treat hearing loss, tinnitus, vertigo. We're seeing a lot more kids now that are failing hearing screenings at school. So hearing loss is rising in that population.
Why would that be? Children? rising?
Oh, a lot of it is from headphones
Oh, yeah.
and excessive use and volume. Yeah, and I will say this, that hearing losses are getting identified earlier and earlier,
Wow.
which is kind of sad. Because even a mild hearing loss is affecting everyday schoolwork, reading, comprehension, and the kids have to pay more attention and they're missing stuff. And so some of the teachers are actually identifying it too, like this, they're not doing as well as they did. So they're getting smart and having them tested.
Interesting. Okay, so let's talk about the link between cognitive decline and hearing loss. Can you explain that to our listeners?
Well, studies are now suggesting that older people with hearing loss are more likely to develop Alzheimer's and dementia. And that hearing loss can be associated with a faster rate of cognitive decline. There are several theories. One of them can be cognitive load, where a patient has untreated hearing loss. The brain gets so overworked by straining to understand and to try to hear speech clearly, and the patient's listening effort is at maximum, and so that causes some of that cognitive load. Another one is our actual brain structure, that our brain cells shrink with lack of stimulation, including the parts of the brain that receive and process sound. Lastly is social isolation. So when a person has trouble hearing, they find that conversations and socializing gets harder and harder. So they stay home and thus isolate themselves. So that means less stimulation that the brain receives. So in the past, everybody was all about, brain activities with puzzles and that kind of thing. Now we're finding that that auditory input is so important at a normal level.
So what about some other diseases again linked to hearing loss?
Heart disease, cardiovascular disease, diabetes, depression, anxiety, chronic kidney disease. Experts are now trying to say that we need to keep our brains and our bodies healthy as we age, because it helps us to stay mentally stimulated. So keeping up an active lifestyle with friends, family, business associates is one of the many ways that people can stay mentally engaged. So we encourage this through good, healthy hearing, including hearing aids for those with hearing loss.
Amazing. I didn't realize that so many disorders caused hearing issues.
Yeah. Diabetes is a big one, and we're seeing that a lot. And it's especially prevalent in women. It seems to be more prevalent hearing loss associated with diabetes in women than even men.
Wow.
Very interesting. Let's talk about hearing aids. Occasionally we get questions in the pharmacy about hearing aids and are they for me, or, oh, they're too expensive. Let's talk about technology and how you can manage settings from your smartphone or your smart TV.
All of the manufacturers today have, whether it's rechargeable instruments or battery operated, all the manufacturers have the capability to directly Bluetooth connect to a smartphone or even a remote control. But the smartphone is important because your smartphone, you can download an app and you have a remote control features for your hearing aids through the app. You can directly stream phone calls binaurally. So a lot of times the patients with any degree of hearing loss, when they're on the phone, you take away one ear and you take away vision. So that's really hard. So being able to stream in both ears is amazing, as well as streaming music and podcasts. And it's not just an amplifier, because that streaming is based on their hearing profile and how we program those hearing aids. So patients can, answer their phone in multiple ways. They can answer their phone by tapping their phone. Some of the hearing aids today, you can double tap your ear and it answers the phone. You can double tap the other ear and it'll start streaming. So like I said, all the manufacturers at all the technology levels. So it's not just for patients that can afford premium hearing aids. just basic technology, you can still do that streaming. And the smart TV connectivity is a little harder for older adults to get that concept. So we can get what's called a little TV Connect, which is an intermediary device that you just connect to your TV, and it's a separate program. But again, you can stream. So anybody else in that listening environment that you're watching television with can have the volume however they want, and then they can stream into their hearing aids. Which it's a life changer for a lot of people.
It just sounds like it's a lot more flexible, and it does seem that hearing aids today are possibly a little bit more physically attractive than maybe they were in years past. So maybe if there's that stigma, like we mentioned at the beginning of the program, I mean, none of us like to admit we need help for anything. So hearing especially seems to be one of those. So that might be one of those things where, is it any different than the earbuds you're wearing for your, listening to your phone or music anyway? So, but anyway, I digress.
Actually, they look better than those earbuds. And that's a comparison that I make all the time. It's just something that's out there now. But a lot of times when the patients come in, they're not really worried about the cosmetic factors anymore. However, when I show them what a hearing aid looks like in my ear, they're like, oh, I can't see it. I mean, even if I have my hair pulled back, that way they can really see what it's going to look like for them, which is nice.
Yeah.
Oops. Okay.
All right. So let's talk about price, because with every convenience, there comes an expense. Does Medicare pay for hearing aids, or how do patients approach the expense of hearing aids?
Medicare does not, because Medicare considers, hearing aids an elective item. Yes, they will, they certainly improve the quality of a patient's life, but patients can live without them. However, the cost of hearing aids really depends on the technology level. And we live in a capitalistic society, so some practices can charge a lot more than other practices. So the user has to be smart and do a little shopping around per se, but you have to compare apples to apples. One practice might say we do this, this, and this, and it's this charge, and another practice says this, this, and this, but it's like, are we comparing apples to apples instead of apples to oranges? So a good rule of thought is, typically you can spend $2,800 all the way up to $6,000 on a set. But not everybody needs those $6,000 hearing aids. And I talk people down all the time, and they're like, what? You want me to pay less? Yeah, you don't need some of those features. You'll never use them. So, I did that over there. I'll do it here. I just want the patients to be happy and hear and have better quality of life for themselves and for everyone around them, because their hearing loss, a lot of times they don't realize that their hearing loss affects everybody, not just themselves.
How do you differentiate?
So we always like a significant other to come in, especially with diagnostic testing and when I'm talking about hearing aids, because the significant other plays a huge role, whether it's a spouse or even one of their kids or friends. It's important to have somebody else there.
Wow. Okay, time for the first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Flu vaccine along with Moderna and Janssen COVID vaccine are available. Stop by any of our stores to get vaccinated. No appointments are necessary.
Okay, before the break, we were talking about Medicare's lack of coverage of hearing aids. And I just wanted to throw out that, that probably doesn't make sense to a lot of people, but just as a comparison, Medicare doesn't cover blood pressure monitors, home blood pressure monitors either. So while Medicare covers a lot of things and can be very valuable, there are some limitations. So sometimes we have to kind of be a good consumer and make sure we're well informed to look for what we need. So speaking of insurance and things of that nature, how about commercial insurance? What's the story on commercial insurance for hearing aids?
Well, it really depends on the commercial insurance plan. Some insurances do have coverage for hearing aids, so it's actually a benefit for the patient that the insurance company's contributing financially to it. It's really rare to find an insurance company that's going to pay for a full set of hearing aids. It's usually, okay, we're going to cover this portion, the patient's responsible for the difference. Now, there are what's called third-party administrators that are now the middlemen between insurance companies and hearing health care providers like myself, hearing aid dealers, ENT offices, whatever. So what they're owned either by the hearing aid manufacturer or their insurance companies. So they control the products, they control the cost, they control the level of care, and they control the reimbursement to myself. And you have to be credentialed and you have to be in their plan to be able to see these patients. So the patients essentially will, we have to go and do research based on their third-party administrator, what's in their specific plan. The patient pays that third-party administrator. They don't pay me. I do the work. I do everything. The patient has a longer period that they can try out the hearing aids at no cost to them. If they decide to return them, I get a minimal fee, even though I've done all the work I would with a private pay patient. And they're able to keep their costs down because, again, they're owned by insurance companies and the manufacturers. So they buy in such huge bulk. But sometimes it is an advantage to patients that couldn't otherwise afford hearing aids. So there are a few plans that I am participating in. And but Ohio right now is the #1 state that has third-party administrators with insurance companies. In the United States, we're #1. So if you're not part of that, you're going to be missing out on a lot of patient opportunities.
Dr. Testa, this business is a real jungle that you're in. I mean, I'm looking at the newspaper every morning and I'm thinking, can there be any more audiologists or any more hearing businesses or any more of whatever? I think you're really gutsy to jump into this. How do you differentiate yourself from other practices?
Well, I would like to say that I do the gold standard of care where a patient will come in and let's say they are going to purchase hearing aids. The one thing that I stand 100%, I do it with every single patient, is what's called real ear measurements. And so I don't just take what the software says is the best fit and prescription for the patient. The patient actually is sitting in my office with microphones down in their ear, measuring what is coming out of those hearing aids to make sure that we're meeting all of their acoustic targets. Now, there are a lot of practices out there that are like, get in, get out, try to sell a hearing aid. And then, we have the service side of it too. So typically I see my patients every 3 to 6 months to make sure that they're wearing their hearing aids, they're clean, their ears are clean. I just try to make it a little bit more friendly and I'm always honest because if a patient comes in with expectations up here, but they'd afford hearing aids here, I'm going to be completely honest with them and say, this is what is going to happen. You're going to have a problem here, here, and here. You're going to do better, but not as good as you think you're going to do. But it is a big business around here. And the thing that a lot of the patients don't realize, they don't know the difference between an audiologist and a hearing aid dispenser. They don't understand the difference in the training, which is usually about 6 years. And we have a doctoral degree and they might have a high school equivalent degree. There's good hearing aid dealers out there. There's bad audiologists out there. But the patients are the ones that really pay sometimes. And I see some of those patients too, where they've gone somewhere, come in, and I want to help them. And so I reprogram their hearing aids and they're like, oh, this is how it was supposed to sound. I'm like, yeah, 2 years ago, this is what it should have sounded like. But then it's a long-term patient for me. And I just want to do what's best. But the patients don't realize too, when they go into those places that have those good deals, they're paying for the advertising. And, there's some bait and switch going on too.
Can I get in the middle of your question, Brad?
Well, I just wanted to, before we get the news break here in about a minute and a half, I wanted to touch on the availability of over-the-counter hearing aids. So those seem to be something that, we've seen at trade shows, and I kind of wonder I mean, I like to think as a pharmacist, we have a wealth of knowledge, but I certainly don't know how to tell a person what kind of hearing aid they need. So can you touch on those?
Sure. So the over-the-counter really haven't been approved yet. This has been going on for like 3 to 4 years. What we're trying to do, or what the FDA is trying to do, is make it a little bit easier access for patients that have a perceived mild to moderate hearing loss. That's where, for audiologists in our business, we're worried. If it's a perceived, I have patients that have a severe hearing loss, but perceive their hearing loss is mild to moderate. So, but the patients themselves, or, the public will be able to buy them over the counter at your office online, and it's going to be a self-fit kind of hearing aid. Now, I'm definitely going to have over-the-counter hearing aids in my practice, but I'm also going to sell my service along with them too. You can buy them here, but yet I can help you with programming them, making sure they're fitting and different things like that. They're still not out. They're coming out this year, but we're still waiting on the final ruling of the over-the-counter. We're hoping that it's going to help some of those patients, that wait 7 years. But we also don't want them to be underfit and not happy. So I definitely will promote a service line with those as well, but they're coming.
Okay, bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy. This morning, we're talking with Dr. Denise Testa, audiologist with Hear the Possibilities. We have a lot more to cover this morning, so let's get back to the show. Denise, Doctor, how tightly regulated are you by the state? Licensing and all that sort of thing. I mean, I would think they have you tied down just like they have pharmacists tied down.
Yes, they do. Yes. I mean, I'm licensed by the state, the Ohio board. I have certifications with the American Academy of Audiology, the Academy of Doctors of Audiology, American Speech, Language, and Hearing Association. So yeah, there are a lot of rules and regulations, which is good because it's good for the public.
Sure. So let's talk about the adjustment period for hearing aids. I hear people on occasion that they don't know it, but they're whistling. Their hearing aid is whistling, stuff like that. I guess I don't quite understand why, if they have a hearing aid, why they can't hear that, but I don't know that much about the science of a hearing aid. So anyway.
Well, typically they can't hear it because it's such a high frequency sound that we can't even amplify that out. But patients shouldn't today have feedback whatsoever. So feedback is just re-amplified sound. So whatever leaked out that got right back up to the microphone is feedback. So if they're fit properly and feedback managers run, patients should be able to go like this and not hear any whistling whatsoever. However, if they don't have follow-up and regular cleanings, it could be wax related, where the wax is impeding the sound getting in. So it's just bouncing off the wax and getting re-amplified. And I see that all the time.
Well, I know that the hearing aids that are in the marketplace are much more sophisticated than what we've seen the last 20 years or 15 or whatever, smaller, all that sort of thing. And so how difficult are they to adjust to?
They really aren't if the patient is willing to give it their all. And what I tell them, for a new user is, when your eyes are open, your ears need to be open. So when you get up in the morning, put the hearing aids in. Yeah. And, I do have some patients that are alone. So they're like, well, I don't really need it in my house, but they do because they need to get used to their world. They don't know what they're missing because they're missing it. And then they decide, I'm only going to wear them when I go out. And then they have a harder time. So with good with counseling, it's imperative. And in the state of Ohio, patients have a 30-day trial period from the time they're fit until they make the decision if they're keeping the aids or not. Now, there is, a fitting fee if they decide to return them, and each practice can determine what that fitting fee is. But my patients see me on average within that 30 days, at least 3 times, especially if they have Bluetooth connectivity with their phones, because that's a whole other can of worms. It's first getting them used to getting the hearing aids in properly, turning them on, turning them off. Most of them are rechargeable now, so they don't have to worry about batteries. So we've taken that dexterity issue out with the batteries. But just getting them used to wearing them. And, you know, statistically, I think it's like 60 to 90 days by the time your brain actually gets used to things, and it can kind of like file. I tell my patients that it's almost like we've opened all of the filing cabinets when you get hearing aids. And so your brain is really like, oh, what is all these sounds? So the more you wear the hearing aids, those drawers get shut, so that you're not always aware that, oh my gosh, what's that noise? Unless you want to pay attention to it. But then I also have the patients that come in and they're like, well, as soon as I take out my hearing aids, it changed my hearing. It's so much worse. Like, no, your new normal is better, which is a good thing.
I love it. Okay. You just mentioned that people, some of them live alone. Okay.
Yes.
Take out their hearing aids at night. Okay.
Mm-hmm.
What's the solution for you're sleeping or whatever, you don't hear anything, something goes wrong in your house, somebody breaks out, what do we do overnight?
Well, there's alerting systems that you can get. I have patients that do really have a profound hearing loss as soon as they're out. You know, they can't hear anything. So there's different devices that you can get, alerting devices, like bed shakers, pillow shakers, alarm clocks that are really loud. I do have some patients though that regularly will wear one hearing aid to bed, but then we have to see them more regularly to make sure that they're not getting accumulation of wax or just different things down in their canal because there's so much moisture buildup. We have that problem with those power hearing aids. You know, if they don't give their ear canals any kind of break, you know, they kind of, you know, there's some bacteria that grows, and which is not good.
You know, I think of myself as having near perfect hearing. Okay.
Oh, I'm sure you do.
And I know, you just took a shot at me. Okay. But anyway, okay. I do hear, you know, overnight, you know, noises, if you will, like the neighbor's truck or you know, somebody going down the road with a noisy vehicle, or even inside the house noises like the heating come on and the furniture creaking maybe when the heat comes on or goes down or whatever. So I would really miss those things if, you know, if I had to use or wear hearing aids. How many people comment to you about that when they talk to you?
Most patients don't wear their hearing aids. You talking about when they're in bed?
Yeah, sleeping.
Because they're not comfortable. Oh no, they take them out.
Okay.
They take them out for bed because it's not comfortable to lay on them for sure.
Yeah, sure, sure.
But some do though, but I would rather they don't.
Okay.
But some people get in the showers with them too, and I'd rather they don't.
I would miss the creaking of the furniture when the heat comes on and goes off and all that sort of thing, and the air conditioning, you know, whatever. So,
but a lot of the patients that do wear hearing aids, they take them out and they don't hear that stuff. So they rely on, you know, some of those other devices that I had mentioned, or a spouse.
Do you recommend they have smoke alarms in their house for sure?
Oh, heavens, yeah. Everybody should have those.
Yeah. Okay. Yeah, but everybody doesn't.
I know, that's true.
Okay. All right. So some of the most common problems with hearing aids, is there a huge list or just a few?
I would say the most common would be that patients aren't adequately fit and they're wearing hearing aids that under amplify. And, you know, patients really need to come in for regular follow-ups. Kind of think of it as the dentist every 6 months, just for a clean and check, clean their ear canals, clean the hearing aids. A lot of the manufacturers also have firmware updates that are necessary for the hearing aids because they have found over time that this certain problem happened to a specific number of those circuits. And so having them come in, clean and checks, I always connect the hearing aids to the software just to make sure where we need to be with the firmware on the hearing aids. Also, all the hearing aids now have what are called data logging in them. So it tells me how many hours the patients are wearing the hearing aids, what percentage of the time they're in different listening environments, are they constantly adjusting their volume? And if they are, that allows me to open up a conversation on, shouldn't these just be a little bit more automatic? What are you doing, or what situations are you in that I can help you better so that you're not constantly adjusting your hearing aids? Because ideally, I would love a patient to put the hearing aids in their ear in the morning and wear them all day and not have to do anything other than, if they get a phone call, tap their ear, tap their hearing aid, talk on the phone, stream, those kind of things.
Okay. On average, how long does a hearing aid last? And the sideline question is I know the technology on these things is increasing dramatically.
Mm-hmm.
Do we take trade-ins, or how do you handle that?
Well, the manufacturers will guarantee that they can fix a hearing aid up to 5 years. So just like you said, there's always these technology updates. But what happens is, at that 5-year mark, between the 4 and 5 year mark, I typically will talk to them, and we'll do another eval to see, are there certain listening environments now with your current hearing aids that you're having a problem with? Might be time to upgrade them. However, some people can't afford to do that. But the hearing aids get really expensive to get fixed after 5 years. So I usually, we can send them in and get an estimate. At my former office, we never allowed trade-ins because there was really nothing that we could do, because you're not legally allowed to resell a hearing aid that's been on someone else's ears. However, I think it's done, but it's not, your licensure really could get in trouble for that. But it really depends on the patient's situation. But the other really nice thing is, if some of my patients, and I actually had one yesterday that, she's been my patient for years and she needs new hearing aids. And I talked her off the ledge of getting premium hearing aids, because the technology advancements in the 6 years since she's replaced them have brought her down to a level that is going to save her $2,000. And she was like, you don't want me to get premium? I'm like, you don't need premium. You're 6 years older, your lifestyle's changed. So there's a lot of communication between the provider and your client / patient to get the right hearing aids for their right listening and lifestyle needs.
What about alternative devices? Is there something other than a hearing aid available for people?
Well, there are. They're called PSAPs, or personal sound amplification products. Those are not regulated by the FDA because they're not supposed to, be a hearing aid. Essentially, there's, a PSAP is like one of the TV ears that people get when they watch television because they're having a hard time. Or hospitals, nursing homes use like a pocket talker with some of their patients, so that they can just put headphones on and then someone has a mic so they can communicate that way. There's some PSAPs out there for hunters, so that when they're out hunting, it gives them some amplification, but they're not hearing aids because, again, they're not regulated by the FDA.
Poor animals. They don't have any choices, do they, anymore?
Nope. Nope.
Gosh.
So you touched on hearing loss with headphones earlier in our program. Can you talk about what you're seeing? And, let's be frank, earbuds, headphones, they're not going away. So how can we safely wear them and use them and not have them cause us some detriment?
Yeah. Well, they have found 1 in 5 teens have some form of hearing loss. This is 30% higher on average than it was in the 80s and 90s, because just like you said, they're not going away, they're there. But what we have to realize is that a lot of times the volume can be up to 120 decibels, which is like a rock concert. So after 75 minutes at that level, they're causing hearing loss, and it's not going to go away. So prevention is the best. So as a rule of thumb, 60% volume for 60 minutes a day, which, the teenagers aren't doing it. Young adults aren't doing it. However, The other rule of thumb for parents with their kids is if they're trying to have a conversation with their child and they're completely being ignored, it's too loud. Or if you can hear what's going on when they have headphones on or earbuds, it's too loud. And in the past, there was different, like the MP3 players. You could go in as a parent and put, controls. You can control it that way, but there's no way I could control my 17-year-olds because she would just go in and, she shows me what to do. But you just have to be smart. So the best measure is we have to prevent it now. And it just needs to, I think there needs to be more advertising, or not maybe even advertising, but more awareness with parents. And I think that comes at a pediatric level, actually, because they're starting younger and younger.
Yeah. Okay, doctor, our final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy. We are back with our final segment of the show. And this morning we're talking with Dr. Denise Testa, audiologist, with Hear the Possibilities.
Okay, before the break, you touched on some things parents could do to possibly help prevent hearing loss in their children. Is there anything else you wanted to add?
I think they should definitely stay on top of the kids' hearing screens in school. And this is on a personal note, and I hope my daughter doesn't get upset with me, but she had failed her hearing screening in 9th grade, and I just thought, she's messing around. I brought her in, and we discovered that she had bilateral hearing loss. So by the time I finished testing her, she was crying, I was crying, and hearing losses pop up, and we didn't realize it. And I'm an audiologist, and I didn't see it. We just thought she's loud. My husband said that we should have named her, Amplifier instead of Blair, because her name's Blair, because she was always so loud. And so she is, she's wearing hearing aids now, and she's 17, and it just. Her hearing loss doesn't define her. It's just part of who she is. But the fact that it happened in my life and we don't know why, and I don't think it was noise induced. We did everything, MRIs, CAT scans, genetic testing. We just think that it's a recessive gene that my husband and I both gave to her. Lucky her. But on the other hand, she has a mom who's an audiologist, so which could be good or bad.
Wow. Okay. How about when should a person have their ears cleaned professionally?
Probably more often than not, because we see patients that are cleaning their ears, and what they end up doing is just pushing the wax deeper and deeper with Q-tips. And Q-tips are more abrasive than they actually are soft. You think that they're soft, but patients use all kinds of stuff. But it's almost as though when they're cleaning their ears, it's kind of like a wine bottle, the way that our ear canals are. So it's open at the end, it's narrow, and then it opens, and they just get it pushed down farther and farther. And so ideally, if you have any degree of hearing loss, your ears are popping, they're clogged, you really should see a physician or an audiologist. Hearing aid dealers aren't, it's not within their scope of practice to clean out ears, so don't go to there. But I check every single patient that walks in my door. That's the first thing I check every single time, that path. So it should be done regularly. And statistically, 2/3 of the patients in nursing homes have impacted cerumen in their ears. Jeez. Which is crazy, which leads to a whole bunch of other problems. But yeah, that's a big business. So there is somebody out there, not in Ohio, but she opened up her own personal audiology little minivan that she goes to nursing homes, and all she does is see residents there to clean their ears, which is a big business because it's private pay for us.
Wow.
So what about this? Can you give a explanation of what a garden variety visit at your office might be for a person who would come in for the first time and has never been to an audiologist?
Well, the first thing that we do is we welcome them with open arms and just check them in. We do a complete and thorough case history, and then otoscopy, which, I check their ears. If they need their ears cleaned, I clean those. We do a diagnostic hearing evaluation, air conduction, bone conduction, speech and quiet, speech and noise, tympanometry to check the middle ear status, otoacoustic emissions to check hair cell function, and then after the testing is complete, they typically, if I see that there is a hearing loss, then they complete what's called an HHIA, which is a hearing handicap inventory scale, so that I can get an idea of what how the patient perceives their hearing loss. And then we sit down and we go over all the results and my recommendations. If the recommendations are amplification, we discuss that. While the patient is with me, my assistant is checking their insurance to see if they have commercial insurance coverage, or if they have a third party, or if it's all going to be private pay, so that we can get down to the nuts and bolts that day. And those first appointments are an hour appointment. And my time is dedicated to them, answering all their questions. We typically ask that like I had said earlier, a spouse come in, a family member, just to, hear everything that I'm saying and to validate some of the issues they're seeing with, their significant other. But yeah, in those appointments, if they're coming in for a diagnostic for the first time, that's billed to their insurance company, that diagnostic eval.
Okay. I think we pretty much killed this discussion of wax, but how long-term issues are there? Long-term issues to wax buildup? I mean, okay. I know that just about every person in the world uses Q-tips, okay, because of the way we sell them in our stores by the boatload, if you will. So we put them on sale and they're gone, that sort of thing. But I've heard stories like, in fact, this is a story from one of my staff members, where she had a Q-tip sticking out of her ear and her little kid came by and whacked it through her eardrum. So, I mean, I don't know how often that happens, but I said, whoa, that is not good.
It happens more often than you think. Damage from people trying to clean their ears.
So what do we do? Older adults, how often wax cleanup?
It really depends on the person. If they have hearing aids, more often than someone that doesn't have hearing aids, because the hearing aid is foreign to the ear, and there's a natural process that the ear performs to get rid of the wax. And now if you have a hearing aid down in there, that actually stops the migration, so it just builds up on itself. I think that as a general rule, when the patients go into their primary care physician's offices, they need to have their ears checked then, because that is a covered service with Medicare and all commercial insurances. However, I don't think it's done as much as it should be. And if the patient then gets referred to us, it's a private pay. It's within my scope of practice to clean ears, but Medicare doesn't reimburse us for that. But long-term effects is really hearing loss. Also, I've had patients that, I had a patient one time that it was crazy the amount of stuff that she had in there, but infections, and, I'll see some patients that it doesn't smell very good. So I know that there's an infection brewing in there. So I will take a look in there. If I see that, I definitely refer them back to their primary care, because, within my licensure, I can't recommend a treatment option for it. That's definitely medication.
Okay. Two questions in one. Are there steps people can take to minimize hearing losses when in crowded, loud areas? And also, can you talk briefly about tinnitus?
Yeah. So crowded, these are good factors or suggestions for anybody with hearing aids or, not. You want to stay in good lighting so that you can actually see the person that you're talking to. You want to use facial expressions. I know that in the past couple years with masks, so many folks have realized how dependent they were on visual information, especially with hearing losses. You want to make sure that you're speaking clearly, not necessarily at a slow rate, but clearly. And if you can take yourself away from the noise source, you're always going to do better. Tinnitus is, just one of those things that people have. And tinnitus is actually a noise in your head that is not caused by an external sound source. It's something that just is going on in your ears. It's usually caused by an underlying issue, whether it's related to hearing loss, an injury, middle ear disease, circulatory system diseases. And the only way to really manage it is potentially sometimes hearing aids, ear protection, different things like that. A couple of other things that patients can do that have tinnitus is limit alcohol, caffeine, and salt intake, because that makes it worse.
Okay, doctor, guess what? We're out of time. We could go longer because I know we wish you very well. Thank you. Thank you, Denise Testa, audiologist with Hear the Possibilities. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thank you, Studio Arts and Glass. And of course, our technical producer, Ingenuor Estates. As always, thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.
Thank you.
Good luck to you.
Thank you very much.
Thank you very much.
Very interesting show.
The preceding program was sponsored by the Medicine Center Pharmacies.